Hi ladies, today what we're going to talk about is the guidelines surrounding exercise in pregnancy. Having worked with thousands of pregnant women through my career, I know that what happens is women often get pregnant and then they start to become quite fearful surrounding what exercise level they should be working at, what exercise they should be doing, what they shouldn't be doing, how far they can be pushing themselves. And I also get the other camp of women that have never exercised prior to pregnancy and then think that, well, maybe now's a good time to start. So we're going to have a little bit of a chat about that today because it is so important. The health benefits surrounding exercise in pregnancy are simply undisputable. So we've got all the regular things that exercise brings, such as improvement in cardiovascular fitness and maintaining your muscle strength. And trust me, once that bubby comes along, you need as much strength in your body as you can. But the other things are things such as reducing your risk of gestational diabetes, reducing your risk of preeclampsia, helping with unnecessary weight gain, and a big one is mental health, okay? So managing kind of mental health, managing anxieties, managing all sorts of kind of things that happen in the pregnancy and the postpartum period. You're more likely to exercise postnatal if you exercise in pregnancy as well. The other really big thing is improved ability of mother, not just mother, but baby to cope during labour. So they have done some what we call Doppler kind of scans to actually show how the babies coped in labour, and those women that are actually exercised through their pregnancy, their babies tend to cope better in labour. So there's so many benefits to actually exercising in pregnancy. In the past, okay, so we're talking kind of in the early kind of 1900s, mid 1900s, women used to be wrapped in cotton wool and be almost put on bed rest, okay, when they became pregnant. And then over time, we've become a little bit more flexible and women were allowed to walk and do things like Pilates and yoga. Over time, okay, what we have seen is that there has been a little bit more research that has been undertaken that has shown that there is absolutely no evidence to suggest that women shouldn't be doing exercise, such as running, such as weights, okay, things like that, as long as that woman is comfortable doing it, as long as she's exercising at what we call a moderate level, and we're going to get into that. So we know that exercise during pregnancy does not increase the risk of things like miscarriage, preterm birth, growth restrictions, any harm to the baby, okay? As long as we are exercising within what the guidelines tell us to do, which is what we're about to jump into. So I really want you to feel empowered to exercise and feel confident in exercise. We know across Australia that only 15% of pregnant women are actually hitting the recommended level of exercise that they should be hitting in pregnancy. And we are definitely moving towards a culture of ensuring women continue their exercise. You know, something you did in prior to pregnancy, there should be no reason that you shouldn't be able to continue it in pregnancy with some modifications, okay? So all of these things, what I'm talking about is women with what we call uncomplicated pregnancies, okay? So I'm just going to quickly rattle off when we've got pregnancies that are where exercise is actually what we call a contraindication, so we don't want you to do it. So women that have had severe heart disease, okay, if you've got lung disease, if there's severe what we call intrauterine growth restriction kind of happening, we shouldn't be exercising. If we have high blood pressure, placenta previa, what we call an incompetent cervix, if we've got constant bleeding through the pregnancy, then these are situations in which we shouldn't be exercising, and then you would absolutely be under medical management because you're what we classify as high risk. Those women that are carrying twins, you can absolutely exercise in pregnancy, but we do take a little bit more of a less aggressive approach per se, so we would actually get you to usually pull back on exercise a little bit later on in the pregnancy, and usually your body will guide you that way anyway. So let's look at what the recommendations say. So the most recent Australian guidelines when it surrounds pregnancy and exercise, so they were the 2016, what we call RANZCOG, Royal College of Australia and New Zealand Obstetricians and Gynecologists. They have 6 main recommendations. I'm going to go through the first 2 because these are the ones that are evidence-based. Okay, so the first one is that women in pregnancy with uncomplicated pregnancies should be participating in aerobic and strength training exercise through pregnancy. The second recommendation, again based on evidence, is that women should be advised that there is absolutely no evidence that women should not be exercising in pregnancy because of harm to the fetus. Okay, so feel really confident because they are evidence-based guidelines from experts. We've also had the Canadian guidelines come out last year that have said the same, and they've very much kind of actually gone even more aggressive with the exercise level that women can exercise at. So it's so fabulous, and we are so happy here at the Empowered Motherhood Program that we have these guidelines that have come out that you can feel confident in exercising. So the other recommendation, so there's 4 other ones, so I'm going to very quickly go through those, and then we're going to just nut into exactly what exercise you should be doing in pregnancy. So recommendation 3 is about assessing your risk, okay? So making sure that if you have any of the risk factors, so in terms of complications or other things such as if you're getting dizziness, if you're getting vaginal bleeding, if you're getting any fluid leaking, amniotic fluid, okay? If you're getting severe shortness of breath, if you're getting any painful contractions, okay? If you're getting any kind of symptoms that don't feel quite right, then you absolutely need to stop exercise, assess your risk, okay? If you're not sure because of a certain history, then definitely chat to midwife, obstetrician, GP about your risks of exercising in pregnancy, okay, before starting if you were somebody that hasn't started before. Okay, recommendation 4 is that pregnant women need advice surrounding the right frequency, intensity, and duration, which we're going to get into. Recommendation 5 is that women need to take into account their base level of fitness. Okay, so if you've never exercised before, then it's silly to jump up to doing 150 to 300 minutes of intense exercise a week, okay? So we need to use a bit of common sense here. And then we need to take into account, recommendation 6 is to take into account the physiological adaptations that happen to the body in pregnancy, and they are many, okay? So we need to think about, we've got 50% increased blood volume pumping around our body in pregnancy, so our heart is racing a lot harder to get that blood pumping around the body, okay? Our lungs are working harder just to make that oxygen exchange when we are breathing, which is why you're going to find that you're going to get more short of breath more quickly in pregnancy. We've got changes to that huge soup of hormones in the body that are making all of our muscles and our ligaments a bit softer, okay? So we are going to be a little bit more injury prone in pregnancy. And one of the things we do see a lot is the onset of pelvic girdle pain in pregnancy. And often exercise is something that may actually flare it up if it's not done kind of in the right way. And so women often would get some pubic bone pain or kind of back pain, and that is often because of those physiological changes to the ligaments that are actually supporting the body. We've also, of course, got the actual physical change of the center of gravity. So as our belly kind of grows out, our back tends to sway more. It changes where our body is in space. And so different muscles start to kind of work, okay, in different ways. We've also, of course, got as the belly gets bigger, we've got our diaphragm gets compressed, and so the diaphragm when we breathe should be able to move down and up, and as you're exercising, if it's compressed by the growing fetus, it can't move as much. So again, we're not getting as much oxygen in, and that's one of the biggest things with exercise in pregnancy, is making sure you're getting enough oxygen in, not just for yourself, but for that growing bub. Okay, so there's so many different changes, and that's without even going to the pelvic floor side of it, because the pelvic floor softens a lot in pregnancy, particularly as we kind of are hitting 3rd trimester. And that's when a lot of women will find that they really want to pare back their exercise level, because they can start to feel a bit of a heaviness in the vagina or start to get some leaking. And those changes are very, very common in pregnancy, and that's your body preparing your pelvic floor, softening it so you can actually get that baby past it. Okay, so my main thing I want you to do is really listen to your body in pregnancy, okay, when it comes to exercise. Don't be fearful of exercise. If you've never exercised before, you can absolutely start exercising in pregnancy as long as you fit within the guidelines. Okay, so let's dive in quickly to the guidelines a little bit more. So what do they actually say? So they say that women should be doing aerobic and strength training exercise weekly, okay? What they then go on to say is that women should be doing 150 to 300 minutes of moderate to slightly vigorous exercise per week. Now, when we're talking about going for a walking stroll, that doesn't cut it. That's not moderate, okay? So if we want some clinical changes that are going to happen in our body in pregnancy to actually keep our fitness going and help prepare our body for labour and all of those benefits that I talked about earlier, prevention of gestational diabetes, preeclampsia, we need to be exercising it at a level that we're actually getting some clinical changes. So 150 to 300 minutes, okay? And when we're talking about moderate exercise, and I think it's best to always stick at moderate. Other people can exercise a bit more vigorously, particularly if they've kind of more of an athlete. But if we're talking about moderate, there's a few different ways we can work this out. We can work out certain heart rates, but that gets quite complicated. The other two kind of ways is using the Borg scale, okay? And so we will provide the kind of Borg scale so that you can actually kind of get an idea of what that is. But it's a rating of how hard you're working. And so we want you to sit somewhere between 12 to 14, which would be described, if you were describing it on a scale of intensity of exercise, as somewhat hard. okay? So think about that. You know, we're happy for you to work at a level that's somewhat hard. The other thing you could do is simply the talk test. So the talk test is if you're exercising and you were with a friend, could you actually, if they ask you a question, or could you actually say a sentence to them whilst exercising? If you can't, you are exercising too hard, okay? This is all based around your ability to get the oxygen into you, down to your baby for oxygen exchange, okay? So that's what these guidelines are around. So I think that's really important. Irrespective of what your base level of fitness is, when you're exercising, you need to be able to talk, and I don't want you to exceed that somewhat hard level on the Borg scale, okay? Keep that in your mind. The other thing they say is that women should be doing strength-based training at least twice a week in pregnancy, okay? So the benefits of strength-based training through a woman's life cycle are huge, okay? Obviously it's maintenance of muscle mass, but it's also bone loading, okay? And in terms of how much kind of strength you need in that postnatal period and as the pregnancy progresses, it's huge, and the less impact and muscle wasting you've had, the better, okay? So strength training is fine, exercising at a somewhat intense kind of, somewhat hard level is fine as well. In terms of how long you can exercise for, we usually say don't exercise for more than 60 minutes, okay? 45 to 60 minutes is the maximum duration that you should be exercising for. And that's just about blood sugar levels, okay? Because if you're exercising for longer than that, your body's ability to what we call thermoregulate, okay? So regulate your temperature, and also in terms of release the right amount of blood sugar levels starts to kind of change around then. So if you are somebody that's, doing some hardcore training, then you definitely need to be getting some advice around exercising any longer than that. The other thing is the temperature in which you're exercising in, okay? So we don't want the body to overheat in exercise, and in pregnancy your core temperature is just a little bit higher, okay? So most women, we have shown that exercising in normal temperatures there isn't going to be an increase in core temperature if you stick to below that 60 minutes. But if you are exercising in a really, really, really hot climate, okay, you need to make sure that your hydration levels are right. Things like warm yoga studios aren't a great idea in pregnancy, okay? It goes without saying, hopefully you're aware of this, but not that you would exercise, but not exercising in a hydrotherapy pool where it's really, really hot, okay? So they're the main things, making sure you get enough oxygen, making sure you're not overheating your body because that's going to affect the baby, okay, as well, and then making sure that you are exercising at a level that you feel that is good for your body, and listening to the signs of what your body is saying, okay? So if your body gives you those signs of dizziness, okay, during exercise, or extreme shortness of breath, it's time to stop, okay? Now ladies, I hope that that's given you a little bit more insight and confidence to exercise safely in pregnancy. In the Empowered Motherhood Program, we take you through all of our workouts are absolutely safe, and we keep in mind all of those physiological changes that are happening in the body. We take into account all of the guidelines as well, and also all of the clinical experience I have in working with women. And ladies, if you haven't exercised before, what the guidelines also kind of do is they absolutely encourage you to start exercising, because pregnancy is a great change for behavior modification, so changing your behaviors, but we need to do it smartly, okay? So what we're going to do is you're going to not jump straight up to 300 minutes of intense exercise a week. You might start by just going for a 15-minute walk, okay? You might start by doing half of one of the Empowered Motherhood Program weight sessions and do it with really light weights, or two tins from the cupboard, okay? So let's use some common sense. Let's really embrace the benefits that exercise can bring in pregnancy, and we know that we're doing something beautiful for our babies, beautiful for our body, and I really, really hope that you enjoy the process of exercising in pregnancy.